Medical shock. What is medical shock? What can cause medical shock? Recognition of medical shock and steps to take as a first aider. As an adult, or any human should I say, we've got blood in our body. The average amount of blood that an adult has is between 7 and 10 pints. Well, actually, it goes on your body weight. It's about 8% of your body weight is blood. Now, there's a fact you didn't know. Depending on the person, depending how much blood they have, they can go into medical shock quite quickly. Medical shock can be obvious in the sense that maybe your casualty has had a really bad accident. Maybe they've cut themselves with something extremely sharp. Maybe they've been knocked over off their bike or hit by a car or fallen off a wall and bleeding. But what if that person's been kicked by something, let's say a horse, or let's say they got knocked over by a forklift truck and bang into the back of their legs? You might not see any blood externally, but there could be internal bleeding. We're going to treat shock exactly the same. A person can afford to lose a pint of blood. And that's why some people, they can give a pint of blood to the blood bank. Some people do it monthly, some do it every 3 months, some do it every 6 months, some people do it yearly. But medical shock can start to happen when they lose 1.5 pints of blood. 2 pints of blood, it's getting serious. If somebody loses 3 pints of blood, it could be fatal. So how are we going to recognize if somebody's going into medical shock? So as I've just mentioned, this is going to happen if they've had a serious accident or caused injury to their body. The person might not be feeling too great either. Edna, how are you feeling, my lovely? How are you feeling?
I feel dizzy.
You're feeling dizzy, are you? Yeah? Yeah. Okay. So Edna here, she had an injury today. She actually fell down the stairs and she hit her head, which isn't great. Now she's feeling really dizzy. Now, I don't know. I can't see any blood on the outside of her body, but maybe there could be bleeding on the inside. You might see heavy bruising on the legs. You might see heavy bruising on their arms. If you suspect medical shock, you have to act really quickly. The first thing we want to do, of course, is call emergency services. We're going to call 999 or 112. The first question they're going to ask is, what service do you require? We're going to ask for an ambulance. As soon as they connect us through to the ambulance, they will ask us, is the casualty breathing? And in this case, they are. What we need to do now is ensure that we get our casualty in a safe position. With medical shock, we want to put the person's legs and we want to elevate them. And once we've got the legs elevated, they may start to feel a little bit better quite quickly. Why are we going to elevate the legs, I hear you ask? We've got 5 vital organs of our body. We've got the brain, which is like our main computer. We've got our heart, which is the engine. We've got liver, and we've got kidneys, and we have lungs. Now, all of our vital organs are either in behind our rib cage or in our brain, which is protected by the skull. How many vital organs do we have in the legs? The answer is 0. So the reason why we need to elevate somebody's legs if we suspect they're in medical shock is to let gravity help us, and that's to get all the blood from the legs and transport it to where it is needed, the vital organs, most importantly, the brain. Once you've done this, then all those organs, especially the brain, will start getting oxygen. We've got her in this position. It's absolutely essential that we want to keep the person warm as well. If you've got a blanket, great. If you don't, if you're out in the middle of nowhere, you could have been down a highway. You could be walking down the street and see somebody have an accident. Then get your jacket or somebody's jacket, put something over them to keep them warm. Once you've done this and you've got emergency services on the way, if there's any obvious signs of blood loss, let's say they did fall, let's say they have got a gash in their arm, maybe they did cut themselves with a knife. If you can see blood coming out, you're going to grab anything you can and you must apply direct pressure. So if blood was coming out of this casualty's arm, I'm just going to apply direct pressure. Keep that pressure on until emergency services arrive and ensure that you keep talking to your person, yeah? Reassure them that they're going to be okay and help is on the way. If it's internal bleeding though, there's not a lot you can do about it. Get the legs up and remember, why are you elevating the legs? We've got to get the blood all the way back to the vital organs and most importantly, the brain. They need oxygen to survive. Keep talking to the casualty, reassure them. And also, you do not want to give them any food or drink. The reason behind this is quite simple. If somebody's gone into medical shock, it's an emergency. They've either got an external injury or an internal injury. And if they need to go in for surgery and they've got food and drink into their stomach, that could be very dangerous. And they may need to delay any operation if required. Or they may have to do the operation and have a risk of somebody silent regurgitation. So shock, what is it? It's when somebody loses blood from the body too much or internal bleeding. I'm Sarah, owner and trainer of First Aid at Work, Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.